Hi, my name is Dr. Ne, the Medical Director of the Richards Clinic. Today, I want to tell you things you need to know about arthritis. Actually, there are many things you need to know about arthritis, but today, I'm going to tell you a few of them. Now, arthritis is a disease of the joint. Arthritis is a disease of the joint. It is not a sign of old age. It's actually not a disease of old age per se, or a consequence of aging. It's just a disease, and it can happen to any age group. But it's just that it happens more in the elderly. As we age, our whole body tends to age with us, and it's normal that degenerative disease like arthritis can be commoner in the elderly, but it can happen to anybody. And there are many types of arthritis. In fact, arthritis is an umbrella name of over 100 diseases that can affect the joint. But the commonest of them is osteoarthritis. So that is the one that is called degenerative disease of the joint. So you have rheumatoid arthritis, you have fibromyalgia, you have pseudogout, you have gouty arthritis, you have juvenile arthritis, the one that occurs in children, and many of them. So our discussions going forward will be majorly centered around osteoarthritis, since that is the commonest one that people suffer. Arthritis can affect any joint in the body. Any mobile joint in the body can suffer arthritis. People confuse osteoarthritis of the knee as the arthritis. When you talk about arthritis, people's mind will go to the knee. No, any joint that is mobile, that is movable in our body can suffer arthritis. From the neck to the low back, to the shoulders, elbows, hip, knee, ankle, wrist, every one of them can suffer arthritis. This is where many people get it wrong. Arthritis is actually two diseases in one. What do I mean? It's a disease that is made up of inflammatory disease as well as degenerative disease. At the beginning of arthritis, at the early stages of arthritis, the inflammation or the inflammatory part of the disease is predominant. As shown by this diagram, this is inflammation. Now, degeneration is usually small, which means arthritis usually starts with inflammation of the joint. That's what confused this medical world at the early stages of discovering the disease. It was described as inflammation of the joint. This is where that description came from. Yes, at the beginning of arthritis, it is majorly inflammation of the joint. This is the time when, if you use medications that are called anti-inflammatory drugs like painkillers, ibuprofen, cataflam, all this, diclofenac, they will bring down the inflammation and you feel better. But what happens is that there is a vicious cycle. The inflammation will encourage degeneration. But this degeneration is still very small at the early stages of arthritis. The degeneration will be encouraging more of inflammation, and there will be a vicious cycle, one encouraging each other. That at later part of arthritis, you have more of degeneration than inflammation. At this point, when you take those drugs that are for inflammation, which is now the small part of the disease, it doesn't work. So that's why many of us have the experience of taking medications and the pain does not seem to go away. The reason is because you are just taking pain medication that are working on inflammation. But the major disease you're having at that point in time is degeneration. Okay? So you have these signs of inflammation, pain, which is very deceptive. So pain is actually what brings the person to the hospital. And that pain is majorly caused by inflammation. So it can have, the place can be hot, especially when the joint is swollen and all that. But majorly, the major symptom people come down with is pain. Now, when degeneration has set in, I use this diagram of a knee. This blue line divides it into a good part of the knee and a bad part of the knee. So this is the part of the knee that has started suffering degeneration. You can see here, this is the cartilage, the white thing is cartilage, this is the meniscus, everything is intact, looking smooth and nice. Even the bone and the capsule that covers the joint, very good and fine. Here is the synovial membrane and synovial fluid, which is the lubricant that lubricates the joint. But here, all of them are suffering. It would have started small like this, the degeneration. Degeneration is wear and tear. As I said earlier on, if this joint has suffered inflammation, no structure here will be damaged. But they might be reddish, sore, causing pain. But when they begin to tear away or wear away, that is degeneration. So most people that present with arthritis are presenting at this stage. The cartilage, the ligament, the capsule of the joint has started degenerating. At this point, the capsule is swollen. That's why at later part of arthritis, you see the joint swollen and thick. Sometimes you think water is there, but it's not water. It's the swollen capsule of the joint. The synovial fluid on the synovial membrane has also become inflamed. The fluid is now reddish, very inflamed, and full of chemicals that encourage more degeneration. Okay? Now, not only in the knee, it happens also in the spine, the bone of the back, from the neck to the lower back. The area that suffer this degeneration most is actually the neck and the lower back, because these are the most mobile part of the body. The chest area doesn't suffer it much, but it does suffer it. But it doesn't suffer as much as the neck area and the lower back area. So you can see smooth vertebrae. The bones of the back are called vertebrae, separated by the disc. Everything here smooth and fine. But when you come here, this bone has deformed. The disc has worn off. The bones are knocking on each other. The nerves here are being compressed and they're suffering compression. Therefore, when it goes down to the lower limb, to the legs, it carries the pain or the sensation down to the lower leg. So that's why some people will complain that the pain was initially at the lower back, but before I know it, it started going down to the back of my thigh and down the entire leg. It was initially pain, but now it's, or some, as the Yorubas call it paja, which is called paresthesia. Some tingling sensation, from there to pain, from pain to numbness, and from there now find out that the leg can no longer carry you and all that. It is because of progressive compression of the nerves that form what is called the sciatic nerve. It is sometimes called lumbago or called sciatica. So it's due to the degenerative process going on in the spine. Just as I said earlier on, imagine you could start treatment at this early stage. As I said earlier on, the major problem in arthritis is degeneration, not inflammation. Inflammation can easily be taken care of. Medications can take care of it, like painkiller, you rest the joint, exercise like physiotherapy, warm or cold pack. Inflammation can go. But degeneration cannot respond to these medications. So if you catch it at early stage and you're taking treatment that can take care of the degeneration, this person will recover very fast and sometimes permanently when degeneration is knocked off at this point. Unfortunately, many of us present at this point when degeneration has taken an upper hand. Okay? At stage 3, stage 4 of osteoarthritis. Okay? So at later stage of osteoarthritis, like stage 4, the degeneration has become so bad that the joints have started deforming and all that. At that point, the person will benefit from surgical intervention. But at stage 2, stage 3, this degeneration can still be healed with a treatment that is called regenerative therapy. And these are the PRP, prolozone, cold laser, and human stem cell therapy. What do? They repair the damage, which is what we call the degeneration. While they are repairing the damage, they are also taking care of the inflammation. But the recovery here is not as fast and as quick as the recovery there. Okay, so that's why we encourage people to come early, treat it early, understand what is going on. That's the sense of this lecture. Because when you know, you can easily take care of your condition. People present late because they do not know. They do not know, and they continue to take the wrong medications, the wrong treatment, thinking that it is going to solve their problem. So that's what we have today for us, and I want to believe that that would have guided us to know what to do and to know the best approach to follow. Okay, continue to follow us in this series of lectures, because as I said, my people perish due to lack of knowledge. It is very apt when it concerns our health. The more you know, the better you can act and take care of your health. Okay, you can like us, you can send this message or this lecture to your friends, family members, because there are many people suffering this condition and they do not know what to do. But the problem here is that it doesn't just start and remain the same way. It continues to progress until it completely destroys the joint and the person might not be able to walk again. It takes a long time. Some people it takes shorter time, but it is usually something that happens. Okay? Thank you very much for your attention. Bye-bye.